I'm Dr. Archita this side. I am a psychiatrist and a homeopath, and today we are here to talk about the psychiatric conditions and how we deal with them in a homeopathic manner. So, the latest common psychiatric conditions which we are able to stumble upon these days are PTSD, depression, and dissociative personality disorder. So, PTSD, most of us must be known about that post traumatic stress disorder. So, what it is actually when a person undergoes a stressful event or something which is not in their favor or something which creates a bad memory for them, then they usually experience such kind of things wherein they recreate such old memories. There are flashbacks, they come in their dreams, and then these things cause some kind of panic attacks, or maybe there are some kind of memory loss regarding it wherein the person doesn't want to remember that whatever happened in the stress event, and this creates some trigger points. So they will, for example, a person has experienced a kind of half drowning experience wherein the person was drowning but then was saved by someone else. Now that person naturally will not go towards a river or a place where there is a long flowing water. So why? Because there is a memory that has been created, and it will create flashbacks for the person. Now the important thing is that this thing can even happen even after 6 months or 8 months of the incident that has passed. So most of us do not understand it and we take it too lightly, which then will leave a bad impression. It may result in forgetfulness, and the person will not be able to do their daily functions of life. Another such thing is depression. Now depression is nowadays very common, and it's a very commonly used kind of a word and a statement. However, it should not be used so. But again, we should be able to recognize it. Now how will we able to do that? Now depression is also something which occurs from an incident. So the person might have a kind of a depressing incident which occurred some days back maybe. For example, there was a family loss, a personal loss, or a business loss. Now that person can experience some kind of phases where the person doesn't want to talk about it, wants to be alone, has increased appetite or decreased appetite. There are low mood disturbances, or it might also hamper in the daily life activities. Also, some symptoms of it might be loss of sleep or increased sleep, that the person is either sleeping all day or is not sleeping at all. Now, we may be able to recognize these, but it is also important to understand that all these things must continue for a period of around 2 weeks consecutively to term it as depression. Only then will we be able to think that this might be a depression and needs treatment. But however, if something has occurred and is creating such incidents but is not there consecutively for 2 weeks, still requires a treatment. Another thing is dissociative personality disorder. Now when we commonly use it, we call it bipolar disorder, wherein person is supposed to be, we are supposed to believe that the person is supposed to exhibit various personalities, but that is not always the case. Now it is very interesting to note that after a period of 6 to 9 years in a child life, or after the age of 9 years, the child may start suffering from this disorder, wherein the child might have suffered from child abuse, or there might have been incidents wherein the ego of the child was very much suppressed. That children may complain of memory gaps or forgetfulness, or some kind wherein they do not identify themselves as personality. Their personality is really very confusing, they are not able to express themselves. Such people may also come into this kind of disorder. Now, homeopathy. So there are a lot of myths about homeopathy, that it kind of creates a placebo effect or it is not that helpful for psychiatric conditions. But first we must know what is it. So it was a system created in the 1700s by Dr. Samuel Hahnemann, and who thought that likes cured likes. Now what happens is that homeopathy doesn't believe that disease is something a separate entity and human is something a separate entity. In homeopathy we believe that there was a disintegrating force that acted upon the inner force, which was the inner guiding driving force, and it reacted in such a manner that the outward picture was reflected in diminished bodily functions. Now, when we say diminished bodily functions, we say that there was a disharmony. For example, you're suffering from cough. That means you will have cough and you will have headache and you will have sneezing. So that is kind of diminished bodily functions. So that is what homeopathy says, that also need an inner treatment. So then we do use such substances which stimulate that inner driving force and helps to fight them out. Again, with psychiatric conditions, if we go in a traditional or a conventional way, then they use salts such as zinc and sulfur, basically mostly to treat the patients, but they always do not help us to reach a perfect goal. The person might become, and there was a depressed patient. Sometimes what happens is we do see faces in their treatment. Sometimes the patient is overexcited, sometimes the patients become really dull. But we do not want a patient to become extremely dull, to not react to something, or we do not want a patient to be overexcited. What we want is to restore our well-being. So for that, homeopathy comes in perfectly handy. What happens is that through homeopathy, the inner force is guided towards a specific system, towards a specific era, and then what will happen is that it will be able to fight the psychiatric conditions, and then we will be able to restore the mental well-being back to whatever it is. In past experiences, we have seen that patients who were suffering from depression and PTSD have very well reacted to counseling plus homeopathy in the most suitable manner, and we have been able to treat them in around like a month of in a time frame of 2 to 3 months as well. So I do really hope that all of you might be able to understand that homeopathy is a better acting in psychiatric conditions. Thank you so much.